Okay, so the next thing we're going to talk about, and this is going to be another short one, is what kind of lab and diagnostics are done at admission in the labor and delivery unit. If you remember, we started all of this with patient comes into the labor and delivery unit, and then we went into what are the things we're going to assess. So at admission, usually a UA is done. A drug screen may be indicated. In some states, permission's required. In some facilities, it's standard to drug screen everyone, but it's done fairly frequently. And that's because some substances can affect the baby after birth. We want an H&H or a CBC, possibly HIV or Hep B, depending on how common those are in the population that facility serves. We want a type in RH or a type in screen. If they're anticipated to bleed more than usual, then they would do a type in cross and just have some units of blood ready. If it is suspected that the membranes have ruptured, ROM is ruptured membranes. If it's suspected, then if they're preterm, a sterile speculum exam might be used to visualize and see if there is amniotic fluid pooling. If they're not preterm and we're less concerned about infection, then there are a couple of tests that might be done. Nitrazine paper will look very alkaline in the presence of amniotic fluid, so it turns this dark green color. And they can spread some amniotic fluid over a slide, allow it to dry, and under the microscope, it appears to be ferning. So those are a couple of tests that might be done. Some of those things you notice are repeats of what was done in the prenatal, but they're still going to be done again at the time of admission for delivery. Okay, so we're going to come back in the next section and talk about ongoing assessment. We've really just done the initial, this patient just walked in the door assessment. So what is the assessment interval and what things are assessed moving forward?